The journey to achieving universal health coverage in the country has entered a crucial stage, with the Ministry of Health subjecting 4 bills prepared to achieve UHC to public participation. In their first exercise, where associations representing health stakeholders across the country presented their memorandum, calls for stakeholders to be part of the Social Health Insurance Board, dominated with associations left out in the bills calling for inclusion. The government targets to deduct 2.75% of gross salary among salaried Kenyans to fund the universal health coverage, which will also benefit elderly persons and those with chronic illnesses.
A week after the 4 draft bills, which will guide the implementation of the universal health coverage, got a nod from the cabinet,
10 years of devolution.
The Ministry of Health has commenced 2 weeks public participation exercise to collect views from health stakeholders and Kenyans. Associations representing health stakeholders were the first group to appear before the team, who have prepared the Social Health Insurance Bill 2023, Digital Health Bill 2023, Primary Health Bill 2023, and Facility Improvement Financing Bill 2023.
And part of our roadmap that I didn't show there of delivery of universal health coverage for both primary care and the secondary and tertiary is to look at the level of service available, look at the infrastructural needs, human resource needs, and the service gaps.
As the counties are trying to collect their own source revenue, one of their sources of revenue is medical services. And as they continue collecting more revenue from that area, we've also noted that what is trickling down back to these facilities is not commensurate to what these facilities are generating.
The associations which have endorsed the bills as a game changer in the health sector have, however, called for more involvement in its implementation by ensuring they are given positions in committees and boards which will drive the process.
We need to have what we call a vote whereby from the services which are being offered from the linked facilities, they can have a vote whereby we can have resources to do these services at the community level, because we do things like action days.
Our concern has been, we as part of community health workforce, and as well as the providers of primary health care workforce, has been left out of the bill.
The bills, which are intertwined, aim at establishing a comprehensively funded primary healthcare system, integration of ICT to enhance health management information systems, ring-fencing healthcare funds, address health challenges for the elderly and those with chronic illnesses, and provision of social health insurance fund coverage for all Kenyans.
NHIF, as of current, is running 90-something plus fragmented pools. That is not in the spirit of a social insurer. So a social insurer should ideally target to have few pools, and those few pools would include looking at household as a whole.
The implementation of the UHC will see Kenyan households contribute 2.75% of their income to the Social Health Insurance Fund, with a minimum contribution capped at 300 shillings. On Wednesday, unions representing healthcare workers are expected to present their memorandum.